be allowed. So over to you, Mercy.
Thank you, Caroline. I hope you all can get me clearly. I apologize in advance for any background noises. People have just decided to have a, what do we call it, a road show outside my office today, but that's okay. So like Caroline has said, I am Mercy Wambua. I'm a clinical psychologist. So clinical psychology is just a branch of psychology. I'm also a trauma and debriefing specialist. So what that is about, I help individuals navigate anything through any event that might have caused them significant distress, be it rape, be it coming from a family that was dysfunctional, so anything that can be termed as traumatic. That's what I specialize in. I am also a master's student at the United States International University, that's USIU. It's in Wambua. I think that's basically just some description about me. So I'll just share my screen. Please confirm that you can see my screen. Caroline?
Oh, yeah, your screen is visible.
Okay, perfect. So the first thing I'd like us to do is just an icebreaker, just to help us to ease into the session. So this one is called Around the World. So what Around the World is, I'll pick a country, anywhere in the world. And then the country that I mentioned, the last letter of that country, the person I mentioned next must mention a country that begins with that letter. I'll say it again. So for instance, if I say Nigeria, and then I call on Caroline, I'd expect that Caroline mentions the next country that begins with the letter A. So we can try that. So I'll go first. So the country I pick is London, and then I'll call on David. David, are you there? Okay, it seems like he's not. So Caroline, I'll give it to you. So mention the next country that begins with the letter N.
Nigeria.
Okay.
And then I pass it over to Ivy.
Algeria. Oh, it still ends with an A. So I'll pass it to Joshua Chalo.
Joshua, are you there?
Albania also ends with the A. Who do I pass it to?
Just anyone on your screen.
Even someone that Asha Fanyo Mambo.
No, you can't repeat.
Okay, let's see. Caroline, Ruth, I pass it to Ruth.
Angola. I pass it to Mwangi ameitwa?
No.
Yeah, Mwangi.
Mwangi is there? Maybe pick someone else.
Mohammed.
Okay, it seems like the rest are not in a position to, and that's fine. That one was just to help us to ease into the session. So, like I said, I am Mercy Wambua, and I have I'm currently pursuing an MA in clinical psychology. So I'm a student. I can relate to some of the pressures that come with being a student. So today I'm going to be speaking on how to manage your mental well-being as a student. So the dynamics with being a student are quite different. Yeah? with any other sphere of life, especially a university student. You realize that here you're adjusting from high school. There's just, you're trying to find your footing and all of that. Then depending on which course you choose, it could be very demanding. So there was a study that was conducted, and it showed that one in every 3 students reported prolonged periods of depression. And I'm pretty sure all of us know at least one person who struggled with a mental illness. Could be depression, could be anxiety, could be bipolar, it could be our relatives or our friends. And certain conditions like now school can worsen the situation. And so out of this, only 50% received no education on mental health issues prior to college. So it's almost like you get into college without knowing, one, what do you expect? You probably don't even know what a mental illness looks like. And many times we term those people as being crazy because of some of the symptoms that they present with. And so mental illness, especially in the days that we are living in because of the current situation with COVID and losses in different ways, losses of jobs, losses of loved ones, then it becomes a stress. And then also thinking about just how we had to quickly adjust from physically going to school. Now you're on Zoom or you're on Google Meet. So there's a loss of your socialization is affected because you're used to having, even just that warmth of being in class together makes it easier to navigate through school. So the first thing I'd like to say is that when you talk about mental health, people usually assume the first thing that comes to mind is it's mental illness. So when you say mental health, you automatically think, depression, suicide, anxiety. But the truth is, mental health in itself is just a state of well-being, and it has 3 aspects. So it means your thoughts, your feelings, and your actions. So when these 3 are operating as is or as expected, then we say that's a state of your mental health. And another interesting to note is that mental well-being occurs along a continuum. At one point of our lives, all of us are faced with certain difficulties. So you can swing anywhere along this continuum. Sometimes you may go through things that push you off, like loss. If you lose a loved one, if you lose even pets, some people end up getting depressed because of losses of their pets. If probably your parent loses a job, that in turn affects you or your sibling, whatever loss you go through, or just a significant event that is really stressful, it could push you to get to developing a mental illness. That's what I mean when I say it occurs along a continuum. So it's not like at your state, a state in itself. You sometimes swing, sometimes you're very okay, sometimes you're really stressed. And so the event, like I said, events that occur around us affect how now or where we lie on this continuum. So there are things that we call risk factors and protective factors. So risk factors, as the name suggests, these are things that put you or compromise your mental health. So they put you more at risk of developing mental illnesses. For instance, gender. Males are thought to be more prone to developing mental disorders simply because, one, socializing. Men don't talk about their issues a lot. And then also just the way they presented things. They may just decide, okay, let me turn to alcohol to deal with that. So before it is noticed, it's a combination of issues. And then there's also age. It's assumed that the older you get, because of the more experiences that you have, then you're more prone to developing mental illnesses. And then there are also things that are called protective factors. So what happens, this means that in the environment that you're living in, there are certain things that keep you more safe from developing a mental illness. For instance, your family. All factors held constant, let's assume that your family is highly functional. Then it means that whatever you're going through, you have communication channels. So it's easy to talk to someone in your family and matters are handled. But then think about a family that is highly dysfunctional. It means that you're also more prone to developing mental illnesses. Say if there's alcoholism, if there's history of a mental illness from your parent, and that puts you more at risk. And then also religion. Religion is, and by religion, I mean our faith. So it could be faith in anything, whether you believe in God, in Allah, in whatever it is that you have your faith in, even if it's just like an object that you believe is your source of hope, then that can also act as a protective factor, because in any way, when you're feeling very overwhelmed or stressed, that's what we turn to. Okay, so now wellness. wellness is when there's balance. Like I mentioned to you, your mental health, there's the cognitive, which is your thoughts, there's the emotional, which is what you feel, and there's the behavioral, now how you behave. These three are interlinked. How you think affects what you feel, and in turn affects how you behave. So the three are inseparable. So in ensuring that you have wellness, it means that all these states of your life are in balance. Now think about yourself as an individual. You don't only exist physically, you have your psychological being, you have your emotions, you have your feelings, you have your behavior. You also have other aspects. Now, like as a student, occupational, you have obligations as a student. There's also environmental. How is your environment? Is it toxic? Is it promoting your mental health? Then physically, how active are you? Are you healthy? Do you have any lifestyle diseases? Then financially, spiritually, and intellectually. So what this means, what I have here, the visual representation is called a wellness wheel. So all these things, as you can see, the circles are interlinked. So which means you cannot exist wholly emotionally and then spiritually at you're not okay and you expect to be performing a high peak performing individual. All these are interlinked, and when one area is affected, then it means that all other areas of your life will be affected. Now, I have a picture here. This thing was a meme. This young girl, there was a saying that she was calling her partner and saying, oh, you know, I have a puncture, but the bottom of the tire is the only one that is flat. The top is okay. But what you know, the most interesting thing is that this car will not move because the whole tire is affected. It's just the positioning. Yeah? So the bottom looks like it's the one that's flat, but basically we know the whole tire is affected. So that's what I mean by saying one aspect of your life cannot be okay, and then you expect cannot be interfered with, and you expect the rest to be okay. That's why it's important to make sure that there's balance. Okay, now I know the question we have is this. Okay, fine. You know you exist as a human being. You have all these different aspects. So now, how do you maintain wellness? Now, emotionally, the first thing would be therapy. Yeah. Therapy is, if you can afford it, it's very helpful. No, therapy can be very expensive, especially in areas where things like insurance don't exactly cater for it. And because they're not regulating policies, some people end up charging extravagantly. So therapy is one way. Also meditation, yoga, breathing, music. These things just help to calm you down. You know, in an event where you feel like you have very heightened emotions, it's very obvious for you to sort of like act out of them, and then you may end up going through all the repercussions, maybe things you're not very okay with. So emotionally, those are some of the things that you can do. Physically, your diet, exercise, avoiding stress, supplementing. I know people joke that when you get into your 30s is when you realize, hey, my back was not as strong as I thought, or my knees. But it's important to start supplementing as early as you can. And then, because I said all these things are interlinked, if your diet is not clean, say you're constantly eating salty foods or highly processed meals, then it impacts the rest of your body, because first of all, sugar and just fatty foods slow down how your brain works. So when you're constantly leaning towards such kinds of foods, then it means physically you're not a strong person. And when you're not strong, like I said, dealing with stress becomes an issue. And then spiritually, like I said, depending on your faith, you could pray, meditate, just be intentional about your pursuit of faith, because that acts as a space where you can get comfort. And then socially, you see, I've written la sherehe, but it has to be responsible. Personalities are another thing that could be either a risk or protective factors. People who are extroverted or people who easily interact with people are believed to be more mentally stable, so to speak, because it's easy for them to speak about their issues. Introverted people, on the other hand, get very drained from interaction. So you can imagine if they are going through stuff, it becomes really difficult for them to find people with whom they can share. So just networking with people and making sure that you're not constantly just reading, like as a student. When it's not class time, find things to do, go out with your friends for ice cream and what. By the time you come back to school, even if you had pressure from schoolwork, you realize that you'll have sort of ease out the stress and it's easy for you to function. Then occupationally, now like a student, you need to be a planner, because what happens is that when you see, you know the saying that goes, when you fail to plan, you're planning to fail. When you have things just jumbled up, it looks very overwhelming. But when you break down your tasks and know I'm planning to do this, like now tech students, you realize that your courses are very demanding, you know. So when you plan to do ABCD and plan your day and you know I'm gonna do this at this time, it becomes easier to manage. And our brains usually work better when we have a plan or when we break down stuff. And then respect deadlines. Procrastination makes what that does is that when deadlines come, then you're stressed because I didn't hand this in good time. And it's like you're running after lecturers. What do? I need to pay for this. Probably don't have the money to pay for your grades and all of that. And then also learn to take breaks. I'm sure all of you have heard about burnout. Yeah? So that's when you excessively put your brain and physically yourself under pressure. So in the moment when you realize, sometimes you can get, tension, headaches. Sometimes it can be gastrointestinal or your stomach, you just have stomach pains, or basically just some somatic symptoms or physical symptoms that could signal burnout, or sometimes you realize you're feeling dizzy. So when you start to get such subtle signals, it's time to take a break. Then financially, as a student, maybe you're not working currently, but what you can do with the little money that you have budget, find spaces in where you can invest. You'll thank yourself 5-10 years to come. Because as students, it's easy to just feel like, because of my money, my parents is giving money, and my help is providing, then there's nothing to lose. But if you're very careful with how you plan your finances right now, you thank yourself in future. And then environmentally, avoid stress or toxic environments. So what this could mean is also try to find ways to cope with stressful environments. For instance, I'm trying to imagine when there are cuts or when your finals. These are almost the most stressful periods in a student's life. So what would be best is just plan. When you have a cut 2 weeks, I'm pretty sure you get the breakdown of the semester at the beginning. Yeah? So probably week 6 you have a cut. Don't wait until week 5 to think, oh shoot, I didn't read. Just make sure you're a good planner. And then intellectually, this one, constantly seek knowledge and network. This is what I mean. You're a tech student, so you're probably engineering, computer science, and all of that. Find things outside of what you do, because more often than not, you'll find people in jobs when they start working. They're in jobs that they did not study for in school. Many times what you do in school is just to have a paper. So constantly be out. If you're a very artsy person, you can join a club that is music, that is painting, that is drawing, and in turn, you can now convert these talents or abilities into things that can make you money. And I think that's basically just an overview. And I think now I can take questions if there are any.
Thank you very much, Mercy, for the presentation. So people can send in their questions on the chat. You can also use Slido. I shared the link. Yeah, it has just been shared again. And before the questions come, I just have like a few general questions to ask. So at what point do you identify that there's something wrong with your mental health? And like when you identify, like when you get to that point, you know what, I need help. Where do you even begin?
Okay. Usually with mental health, by the time stress progresses to something more serious, the effect usually is more around you. For instance, is what I mean. If you are someone who was sleeping for 8 hours, chances are either you're sleeping for 4 hours or you're sleeping for 15 hours. So it could be either a change in your normal way of doing things, or you constantly didn't have headaches, but now you're constantly complaining of headaches. Mara, you're having an ache here, you go maybe to the, what are they called in school, health centers, or to your nurse, and then nothing is showing. So if it's anything outside of what you behave normally, So it could be, or your friends could tell you, and then nowadays you become so aloof, you know, you don't talk to people, or you have zero energy to do even the basics. Just to get up and go to class is an issue. To make your bed, to take a shower. When some of those things now begin to show, I think it would be best to seek help. Now, where you ask. Many times counselors, you know them through referrals, yeah? So it would be best to find someone around you that you can talk to, and then they could recommend a therapist. Or I'm pretty sure even from your school, from either your school nurse or from, I'm pretty sure there's a wellness center or something of the sort in your school. That would be best to begin with. There's also places that offer free psychological services like Kenyatta. I'm not sure if you said Moi University, that's Eldoret. I'm not sure if there's one in Eldoret, but once you notice, it would be important to tell someone, especially like in the health center in your school, that they could recommend a therapist.
Okay, thank you very much. So I'll just be reading a few questions that people had sent through Slido. When you were answering the question about when to know you need help, you talked about sleep, and there's someone asking, like, what are the minimum hours you recommend for someone to take resting or sleeping for maximum productivity?
Okay, with sleep, it's dependent on your age, but now I'm thinking because I'm addressing you, that's probably age, I'd say, so depending 16 to 24, 25, depending on what course you're doing. So it would be 7 to 9 hours of sleep. And it's 7 to 9 hours of actually sound sleep. You know, you're restful. Your mind is not running. You're not constantly thinking, I have an assignment that's due, or I haven't done this and that. So 7 to 9 hours of sleep will be good for you.
Okay, thank you very much. I can see someone by the name Emmanuel asking, how do you know what is causing stress, like the reason behind depression? You know, sometimes you find yourself in a position, you know, you're feeling stressed, but you don't even know what's stressing you. You don't know. If someone asks you what's happening, you can't explain. How do you get to understand what's happening with you and your mind and your body?
In the event that you can't put a finger on what is causing you stress, it will be important to seek professional help, because that way you got an assessment will be conducted. So you'll be asked, are there any significant events that have happened? And sometimes, you know, stress is unconscious. So even when you're going through a period of maybe a lot of pressure in school, that could be one. And you may not think that it's actually an issue until it starts, you know. But the moment, I usually say this, the moment you start to think that you need help, you actually know that something is amiss. So you may not know exactly what is causing stress, but when an assessment is done and you brainstorm, it will be easy to find out, okay, fine. Are you able to tell at what point this started? If yes, what happened? Name all the events that happened within that time that could be causing you stress. Or it could be, in the cases of PTSD, for instance, something that happened way back and now you put it to the back of your mind and that's slowly trickling into your conscious. So that could be another issue. But in many cases, you may not exactly think that something is causing you stress, but in retrospect, you may realize that this and this happened, and it actually could be the reason why I'm feeling the way I am.
Okay, people say the tricky part with mental health, it's not like malaria. You can go get tested and then they tell you have it or you don't. Like, okay, when you visit someone who's carrying out the assessment, will they tell you this is it, or they'll just have like a way to advise you to maneuver around it?
No, when you see a therapist, they're different. Like you see, there you go to hospital for malaria and blood work is taken and it's taken to a lab. It's the same thing. Once you give a history of what it is that you're feeling, then the professional would know what tests to administer. So there are tests that screen for depression, that those that screen for anxiety, that those that screen for suicide. So depending on the information you give, the therapist or your psychologist will be able to identify what assessment do I need to give you so that it points us to a certain direction. Now, it's not in all cases where there may actually be a mental issue. Sometimes it's adjustment. Think about it this way. When you first join university, you know, the environment in university and high school are very different. Like in high school, there's almost like someone to tell you, do this, there's a schedule for stuff. So when you go to campus, it's almost like it's up to you. If you want to go to class, it's fine. If you want to do ABCD, it's fine. So that adjustment could actually be an issue. That in itself is not a mental issue, but it's something that you need to be helped to navigate. So if you go to a professional, a therapist, or a psychiatrist, they'll conduct an assessment by giving you a test. So based on the results, then they would know what it is that you're struggling with.
Okay, so on to the next question on Slido. Someone is asking, what are you supposed to do after you receive some really distressing news like someone's death? How are you even supposed to react, just to make sure it doesn't take a lot of your energy and leave you feeling so empty and depressed?
With loss and grief is a very personal journey. I wouldn't say that there is a blueprint for, so when someone calls you today and said, okay, now person A in your life died, then this is what you should do. All of us, just the things that are called stages of grief. So the first time when you're told, many people maybe may go into denial. The first thing is, you know, when people say, oh no, that's not true, this time it's not true. It's basically your brain protecting you from that kind of heavy information, because the way we are wired as human beings, we're not wired to, our brains are not wired to operate in extremely tense environments or to deal with such heavy information. So there are those who go into denial, there are those who feel really angry, there are those who have regret because they're like, oh, why not for, so for instance, if it's a relative who needed maybe a transplant and none of you are matching them, and they're thinking, what if just maybe if I did ABCD for this person, it would have been better. So it depends, but this is what I'd say. Give yourself time, you know, once you receive that information, allow yourself to feel those feelings in that moment. What happens when you go numb is that you may actually just be moving with the emotion and thinking that you're okay, this person dies, and then kidogo they've been buried, and you think you're fine. But just allow yourself to feel the emotions at that time, and then now find someone to talk to. You know, when they say a problem shared is a problem half solved, don't keep it to yourself. You know, identify, like what I was talking about, social support. Identify people within your circles. Are they your friends? Is it your family member that you can talk about that issue with too, you know? And if it's, especially if it was a terminal illness or something that was that took much longer, it may be important for you when you realize that now it's affecting your functionality. By functionality now is what I think, you know, when your sleep is affected, when your eating is affected, when your schoolwork is affected, you need to seek help.
Okay, well noted. So you've talked about how someone's supposed to act. Then there's like you dealing with your friend who has received bad news. You know, sometimes you get confused. You don't know whether to tell them cry. You just don't know how to handle them. How do you handle them? Just to make sure they'll be, after that period, they'll be very mentally okay.
The most important thing would be to allow them in whatever space they're in. If they're crying, allow them to cry, you know. And then the other thing would be communicate. Find out from this friend of yours what it is that they would like for you to do. Because sometimes you come up with unsolicited advice. You want to tell someone, oh, maybe do this, maybe do that to help you feel better. Maybe it worked for another person, but it's not going to work for them. So the best thing would be allow them. If they're crying, don't stop them from crying. However they're reacting, just make sure that they're not getting very, they're not in a position to harm themselves, because you may find that there are people who may like the first instinct, because of the way our brains function, when you get disturbing news, or your stress response system, it's either you fight, flight, or freeze. So either you will run, you'll want to fight, or you'll freeze. So those ones, especially who are quick to react, and just make sure they're not in an environment where they could harm themselves or harm another person. But it will be important to ask someone what they would want. You know, sometimes what a person requires is just silence, just to empathize with them. Don't tell them anything that may treat them off the wrong way. But also, if it's too much for you, kindly refer them for help, so that you're not causing more harm than good.
Okay, well noted. So I think as campus students, we'd like to hear your opinion on the following topics. The things that stress us the most. Let's talk about love and relationships, because that's the one thing that makes people get depressed, fall into drugs and stuff. So what are you supposed to do maybe in case of rejection, in case of things are not going very well, maybe with your person? Like, what are you even supposed to do so that you don't get depressed? So that's the first thing about love and relationships. Then the second one is about rejection from parents. Like, you feel like your parents don't need you anymore. You call them for help. They're like, you know what, you're an adult, deal with your issues and stuff. So what are you supposed to do in the two events?
Okay, with relationships, the first and most important thing I'd say is to make sure that you're okay with being who you are. Now, let me explain it this way. Breakups happen, people get together and sometimes things are just not working out. And when you're a bit younger, it feels like it's the end of the world. Or when someone says we cannot be together, sometimes it's interpreted as there's something wrong with me. They left me because either I'm not light skinned enough or I don't look like person A, B, C, D, one, this cheating and all of that. So the most important thing will be first to be okay with yourself. Okay, no one gets into relationships expecting that they will end. But in the event that they end, what do you do? The first thing is allow yourself to grieve. The most dangerous thing usually is rebounds or falling into drugs and all of that. If it's a period where you feel like you're really stressed and you just want to cry, you cry, but then also expend that energy in doing positive things. Now, like I said, again, social support. Find friends with whom you can hang out with that are not telling you, okay, now we can smoke weed or we can take shots just to help you feel better. Because with this kind of things, it's temporary. It makes you feel good at that time. And the moment it goes down, you remember you have not dealt with the issues, it comes back to you. So just allow yourself to feel the emotions, but also remind yourself that a relationship coming to an end does not necessarily mean that there's something wrong with you as a person. That's why I repeat and say you should be okay with who you are as a person. Check your self-esteem, and then check what is your motivation to get into this relationship. Sometimes, I know nowadays people have open relationships, and many people just, oh, this is just my life partner. It's not a serious thing. Communicate. If it's a situationship, let the two of you know that this one is not committed. And so if you see me with person X instead of you, just know that it's part of the rules. So communication is also very important in a relationship. So when it ends, remind yourself that it's okay, this one ended, and think about yourself at 19, 20 years. If your life expectancy is 70, chances are you're bound to meet many more people when you go to work, when you just different spheres of your life. It's easy to feel like your life is crumbling down, especially when a breakup happens, but it's also good to pick yourself up and find positive things to do. Then the other thing you asked was rejection from your parents. Now, that one would be, it's a very difficult space to be in because, your parents, you do not expect your parents to treat you a certain way. And if your parents are the kind that you can have a conversation with, it would be important to tell them and just find out what is it that is making them feel like now you're an adult and you can't fall back on them for help. But then also, if it's not working in that sphere, it would be important also now to focus on who you are as a person. This is why I say this, because there are some parents who expect that now they're just going to, I've had people say that their parents told them, but I want you to know that once I'm done with paying your high school, or may I just have school fees for your first degree. Once I pay your degree, then that's it. There's nothing, I don't expect you to ask for things from me. And they're like, that is a very difficult thing to deal with. But then if that's what you're in at the moment, make do with what you have. For instance, if they're giving you money, no matter how little, budget around it. Find a way in which you can use that small amount of money that you have to do something. You can start I've seen people in campus, many of them, you just start a business, maybe buy secondhand clothes and sell, or if you're good at making whatever it is, chapatis or what, there are even people who are really good at doing assignments for other people, then you can do that and make money. Because in certain situations, I'm not gonna lie to you and tell you, okay, fine, there's something you can do to make your parents now change their mind. Some parents are just like that. Of course, they need help, but not all of them are gonna be willing to seek help and deal with their personal problems, because for them to be acting like that, they're basically projecting some of their issues. So if you're not in a position to have a conversation with them and find out where this could be stemming from, probably they just don't understand you. They feel like maybe you have changed, or now they're scared. Some of them are scared because like now I've released you to the wild, and now you're constantly going out, you have a lot of freedom. And if it's possible to have a conversation, well and good. If not, make do with what you have.
Okay, so we'll just focus on the love and rejection part, like for the next two questions, then we'll progress to other questions. The first one is, do you think revenge is it connected to something being wrong with your mental health? And then the second question is, you've talked about parents. So how do you get to make your parents understand that you're not well mentally, that they shouldn't give you too much stress, you're having so much to handle? Not a point they'll tell you, oh, you're feeling now you're an adult, I can't tell you anything. How do you make them understand?
The first thing you've asked is about revenge. So revenge is a matter of appraisal. By appraisal, this is what I mean. It's how you interpret, and then that's based on personal values. It's how you interpret the things that I've gone through. Revenge usually is a way to act, you just want to make another person feel how they made you feel. But then you realize that in revenging, it's either you will end up in a cycle of you and that other person constantly doing things to hurt each other, and that's a very bad space to be in. It doesn't necessarily mean there's anything wrong with your mental health, but unless now it's involving when you're doing really things that I would call crazy, like you want to physically harm someone, or even psychologically harm them and torture them, say you're paying people to beat them, or you are paying people to steal from them, or just frustrate them. I don't think, not unless it's an issue with your personality. Revenge sometimes is just out of anger. You're just very angry, and the first thing you think about is like, me, you're gonna see, you can't make me feel the way I feel. And it's somewhat what people experience when they're going through a lot of hurt. So I don't think it's necessarily indicative of a mental health issue, although it's not a good way to handle stuff. The other thing you said is how to make your parents understand. Now, the saddest bit is this. Many parents don't believe in mental health issues, and I'll explain to you why. Our parents, I'm assuming many of you are probably between, you're not over, I will just assume you're not over 25, 26 years of age. So many of those parents grew up in a time where there was a lot of hardship, but there were no resources to help them deal with that. Then think about it this way. We are Africans, many of us. So sources of mental illness are either someone has looked at you with a bad eye, so witchcraft, or it's punishment for being, it depends on how they look at it in the African setting. So explaining to your parents that them giving you stress or them doing a certain thing is causing you stress that is leading you to depression is not anything that they may understand. Now, what you need to do if you're in such an environment, if you have parents, like I said before, if you have parents who are receptive and can have a conversation with, it would be important to talk to them and say, okay, fine, I am going through A, B, C, D, and this is how it makes me feel. And so I'd appreciate it if maybe you made the environment a little bit more welcoming. If not, now what you need to do is have your own individual coping skills for whatever environment you're in. If at all you feel like the environment is too toxic and you have to get out of it, you feel like it's not possible to work around that environment and remain sane, then you could probably look around and see, is there a relative who would be accommodative? Are you in a space to move out? Because there's some people who are on campus and they're making money. So are you able to move out? But if you're moving out also, do not do it as a form of don't let it look like it's rebellion. If you stay away from home, now like the school you're in, like now boy is in Eldoret, and your parents probably stay in Nakuru, in Nairobi, in Kisumu, you can then choose to protect your mental space, and instead of constantly going home, you can decide to find things to do in school and communicate and just say, I'm not gonna be home this weekend. If you go home or this month, I'm not gonna come home because of ABCD. But what you need to understand is that I don't think there's a way many parents can be convinced that a mental issue is a mental issue. It's like you're just being a stubborn person. Then many of them will tell you, think you're the only one who's been to campus or the only one who's going through stress. So many of them, because of the era that they grew up in, they may not be able to process things as is. So if you're in a space where you cannot communicate, find ways that you can cope as an individual.
Okay, thank you very much. So the next question is someone asking for advice. They're saying they came to campus, they met different people from different backgrounds. Then now you're trying to fit into a class that is, you're not really comfortable, but that's where you want to be. Maybe let's say you can afford only 100 bob for supper, then you want to fit into a class they're taking 500 for supper. And that situation is stressing you because you don't want to lose your friends. How do you manage all that? Like, what do you tell such a person?
Like I said, adjusting into uni can be quite the task. But this is what I would say. Think about the reality of things. If you can only afford 100 bob for supper, which means you have 500 bob for the whole week. So if you spend your 500 bob on Monday, are you willing to stay hungry from Tuesday to Friday? You know, that's if maybe, or you have 700 bob, so you'll only have 200 bob. Are you willing to starve because of, wanting to fit in? And I understand where that is coming from, because it's almost like when your friends can do certain things and you can't do, and it makes you feel like there's something wrong with you. But like I said, it begins with being very comfortable with yourself. You ask yourself, okay, fine, like me, Mercy, if I use all the money that I have right now, what happens the rest of the week? Or say an emergency emerges, what am I going to do, And maybe your parents said, you know what, me, I'm giving you 1,000 bob for this week. If that money issues katikati of the week, that's on you. You decide where you're gonna get that money. And another thing I think is this: if you have friends or you are around a circle of people who make you feel bad because of your finances, make you feel bad because of maybe the way you look or what your parents do, then those are not good people to be around. Because one thing is, you will never satisfy them. Today it will be, don't have enough money. Tomorrow it will be, oh, your parents are very strict. The next time, so every other time, you will be changing yourself to fit in. And by the time you stripped yourself out of everything, then they say, you don't even belong in our clique. So I think the most important thing would be to be comfortable with who you are. I think all of us cannot be the same. There are some people who are from very wealthy families and they probably have things very easy. Just think about where you're coming from and the consequences of your actions. Because you cannot sacrifice your future for temporary pleasure. You're in campus probably for 5-6 years. Okay, now you waste all of that and then you leave campus. Probably some of these people you'll never see again. Now, how do you pick yourself up from that? So I think it's just be comfortable in your own skin. Constantly remind yourself that it's fine. This week I probably may not be able to make that kind of money. Communicate and say, this guy's probably wants to get a bottle of gin. And you're like, hey, me guys, I don't have money for that bottle of gin. If they're willing to accommodate you, fine. But if there are people who are gonna make you feel bad for not being able to afford that now, it basically means that your value to them is pegged on the fact whether you have money or not. So they really don't even care about you as a person. It's just about what you bring to the table. And I don't think those are, so you probably need to evaluate the people that you're around. People that really are good friends to you will not make you feel it's like there's something wrong with you for not having.
Okay, I think that was well addressed. While you are giving your presentation, when answering the questions, you said if you find someone crying over something, you just let them cry. So do you think crying has a positive effect on mental health? And do you think is there something like someone is crying too much, or is it just okay to let out your feelings through crying?
Yeah, crying, crying is an outward expression of what you're feeling on the inside. So definitely crying has a positive effect. It may not be as healing. That moment, you realize there are people who, when they get really angry, they cry, or when they're very anxious, they cry. And in the moment when they cry, it may not have sorted out all their issues, but at that time, they have sort of leveled their emotions. Because when your emotions are very heightened, say you're very angry, you may end up being very violent, or you're very upset, you're very anxious, you may end up messing things. So crying, crying is a positive way to release your emotions. Although, like you're saying, crying too much. Now, that would be if it's affecting any other area of your life. So for instance, if you cannot leave, say you stay in a hostel. If you cannot leave the hostel because you're constantly crying, you cannot go to class, you can't eat. So long as it's anything that is affecting the rest of how you're functioning, then that can be an indication of an issue. Although crying, you cannot say, this one has cried for 30 minutes, that's crying for too long. This one has cried for an hour. But if you realize that it's getting out of hand, or it's affecting how they're functioning, then that is an issue.
Okay, that was well addressed. The next question is, someone raised a concern that probably they've visited many therapists, because they're saying most therapists that they have visited will at one point encourage you to pray. Must therapy be always connected to religion?
No, that one, in fact, whoever did that, that is not, those are against the ethics, because that means that it's imposing their values. Now, if you go into therapy and you mention that you are, say, Christian, and that you pray, and the therapist asks you, are you okay with us doing that? Because if you come into my office today and I tell you, okay, fine, Caroline, close your eyes and let's pray. But I didn't ask you, I don't even know if you believe in the God that I believe in. So whoever did that, that was it was against the ethics. And sometimes you may realize some of these people term themselves as therapists, but if you look into the kind of qualification that they have, then they don't fit that. Think about when you were in high school. Many of the people that you had as guidance and counseling, whoever, whether it was a male or female in school, was basically probably your CRE teacher or just life skills. And those ones are not trained therapists. So those ones are prone to start imposing their values. So therapy and religion are inseparable, yes, because what that means is that if you come to me and your belief is that what you're going through is linked to maybe something you may have done wrong, religion, because our values and our beliefs are also pegged on religion. So you can't say that you do not have religion, but then also no one should tell you that, okay, fine, for your problem X, then go and pray. That is not how it should be.
Okay. Then someone is asking, talking about mental health, is there a way someone can go for mental checkup? Like the way we do maybe blood tests, like twice a year, go for dental checkup. Is there something like mental checkup?
Yeah, like I said, not everyone who goes to a therapist goes there because they actually have an issue. There are people who do it just for personal development. So you can probably just set aside, when you go to hospital, you can request, could I see the in-house therapist, just to, if you say, okay, maybe like I said, we have assessment tests. So there's an assessment test just to gauge your mental health. So you can just do that. Then they go and tell you, okay, fine. Right now it seems like you're operating on optimum, or if there's anything you'd like to discuss, yes. So you can actually get a mental checkup. It's not only going to a therapist because you feel like your life is crumbling. You can just go just for personal development or just to make sure that you're okay.
Okay, that was well answered. So someone is asking, when you talked about religion, how do you deal with a personal change in religion? You realize when you're growing up, not even religion, let's say, maybe you are going to PCA, then you went to a different church, you get. or you found a partner who's a Muslim, you are a Christian. How do you deal with that? And how do you relate with your family with these differences?
You know, religion or any other personal decision is based on what your motive is. So for instance, if you met a boyfriend or girlfriend today or a partner who is probably from a different religion, and maybe you guys have not talked about the longevity of the relationship, and so you said, okay, fine, maybe today I'm going to stop being Hindu and then I'm going to be Christian. So you realize that the motivation behind that is very superficial. So when that relationship ends, it leaves you feeling very devastated. But if the change in religion is based on what you have learned and you have made a conscious decision because you can say, I just don't agree with this principle, this one seems to sit right with me. And in the event that whoever I am changing my religion for leaves me, I will not feel like I did it for them. So if it's anything that comes, because again, you're an adult, when you're a child, you basically do what, so when they say when you go to Rome, you do what the Romans do. When you're born in a Christian family, that's what you do. But when you grow up and realize, hey, these things are not working for me, then you can just, you think about it and think about what is your motivation for that. Let it not be superficial, because again, you realize with whatever change, there are consequences. So you ask yourself, am I willing to? Sometimes it may come with loss of friends, it may come with loss of a family member. Some of your family members will not agree with you. And so you ask yourself, am I willing to deal with that? If yes, go ahead. If no, you realize that this change may cause you more harm, then go. Now, how do you communicate? If it's something that you have chosen to be, it's almost like changing, it's almost like if you want to come out as being queer, you have to go and communicate, being ready for the repercussion. It's not in every home they're gonna tell you, oh, okay, fine, that's fine. Some of them may be like, we've disowned you. So if you just choose to communicate after doing what is called an analysis, a cost-benefit analysis, you ask yourself, okay, now, this is what I'm bound to gain, this is what I'm bound to lose. Am I okay with that? If all of those things are factual, then it's okay. Then you just have to communicate. There's no other way around it. You can't not say anything for them to find out. You just have to say it and take it as it comes.
Okay, so this is not a question. This is just something for everyone. So anyone who joined late and they will want to hear the rest of the presentation, we are recording the session and we're going to share in the groups. So in case you want to listen to it and you don't get the recorded session, kindly just approach anyone, approach Pam, approach Ivy, approach me. We're going to get the recorded session. Okay, so on to the next question. There's someone saying they find it hard to understand their feelings. How do you help such a person? They say they are on the spectrum.
I'd like to know what they find hard to understand in their feelings, because there are people who probably find it difficult to express what we call negative emotions. Like maybe they don't know how to express anger or disappointment, and then those who don't know how to express positive ones are people who do not know how to show affection, and many of these things are from our upbringing. So for instance, if you're in a family where especially boys are not allowed to cry or to be very emotional, so if you're coming from a family like that, then it's bound to happen that in future you may have an issue with expressing yourself when you're feeling sad or when you're feeling angry. So it will be important to check on your background. Just think about how you grew up as a child. Did you have any issues were you constantly told you can't cry, you can't do ABCD, or don't be too hyper, as a girl, you can't be jumping up and down, those are things that boys do. So depending on how you grew up, that could be the issue, why you have an issue understanding how you feel.
Okay.
But I may also add, if it becomes too much, again, just seek help, that you may be helped to navigate through that.
Okay, I believe whoever asked that question, it has been well addressed. In case you need any more clarity, just send in a question. So now there are two questions I'd like to link. It's about how to deal with the feeling of not measuring up to your potential when you feel that you're not doing good enough, and then how to stop self-sabotaging.
Okay. This is what I'd say about not feeling like you're matching up to standards. The first and most important thing would be to ask yourself who sets those standards. You know, many of the times our beliefs of ourselves, we have something that's called an ideal self. So this ideal self, excuse me, this ideal self could be an icon, could be an artist, could be whoever you'd like to be like so and so, or you feel like you'll be more achieved if you are like a certain person. So find out who decided that that is your potential. You know, did your teacher say that you're like ABCD, or do you just believe that you could do better? If it's coming from you, or if it's coming from other people, assess it against what you think of yourself. Because as an individual, you ask yourself, do I think that I'm doing good enough? Yes. If you're convinced you're doing good enough and it's probably not matching up to another person's standards, then you need to remind yourself that you living up to a certain ideal self is for your own good. So sometimes people just put unnecessary pressure, especially depending on what your birth order is. Sometimes you may find firstborns have a lot of people expect so much from them, and then maybe they're more lenient towards those who are younger. So it also just depends. Just ask yourself, who is it for? And then now, when you assess it based on, is this a standard you've set for yourself? If it is, ask yourself, what am I doing currently that is either sabotaging my reaching that goal or is pushing me towards that? For instance, if you say you want to be very financially independent, think about your spending habits right now. How is a person who goes to the mall and you had not planned to spend money, and when you go back to school, you've spent 15,000 shillings on unnecessary things? Or think about just what you want to be. You want to be someone very prominent. Just think about how you're carrying yourself out now. So it's just self-assessment. Ask yourself, what are the things that you're doing now? And then are they pushing you towards what you want to be, or are they pushing you further away from that? So like I said, just assess who determines the potential. If it's other people, then remind yourself you're doing it for you. If it's yourself, ask yourself what you're doing to get you there, or to get you, or what is pushing you further away from that. I don't know if there's another question that I have not addressed, Karen. Or self-sabotage.
Yeah.
Okay. So self-sabotage is an issue with self-esteem. So many times you see your self-esteem is how you view yourself. What belief do you have of yourself? So many times our view of ourselves is affected by many things. The people around you, you know, the words that you heard from your teachers, or the words that you heard from your lecturers or from home. So those become your inner voice. So if you're constantly leaning towards the negative things that they said, you find that even when you're really trying your best to remain yourself, they even said I'm not good enough, so there's nothing I can do. You remember when I was making my presentation, I said that your thoughts are linked to your emotions and to your behavior. So many times failure starts in our brain. When you want to do something, and then that little inner voice tells you, but you're not even good enough, or it's not gonna be like so and so. And then also self-comparison with other people. If you're constantly looking at other people and thinking, hey, why am I not like them, or doing that? That's why you find sometimes you may end up doing things outside your normal self to please other people. And then you see also that leaves you feeling very unfulfilled. So I would say, just check, how do you deal with yourself? Then change the way you speak to yourself, you know, your self-talk. Even when you don't do something well, you remind yourself that everyone is trying at some point. If I did something today and it's not working, I push again tomorrow. If that's not my strength, then I accept it and work on it. So I just think it's all in the way you think and how you give yourself.
Okay, I can see someone has their hand up. Ivy, do you have something to say?
Yes, I have a question. So during your presentation, you mentioned that for physical wellness, we should try and use some supplements. I wanted to ask, what kind of supplements should you recommend? Also, I had another question. So for me, I've been on meters for some time. So I wanted to ask, like for me, my medication was meant to be 6 months, but my family stopped me at 3 months, and I didn't complete my dosage. So I wanted to ask if that is one of the reasons that I keep on having relapses, and if I should probably go back to meters.
Okay, supplements. So it's the basics: vitamin C, vitamin D, zinc. Those are the most common. They help with your immunity. They just help with making sure that you're strong. You can also do omega-3. They're helpful. Now, with what you're saying, yes, it wasn't a wise move to stop you from taking medication before time, because whoever prescribed the medication is a psychiatrist. And usually with medication like that, you don't stop before 6 months, like you're saying. So yes, it could be the reason why you're having relapse, and it would be important to visit your psychiatrist again so that they're able to prescribe the medication again. What happens with medication for mental health is that it alters the way your brain is functioning for a while. So if it's a mood disorder medication, or if it's an antipsychotic or antidepressant, more often than not, they target your brain. So what happens is that sometimes before the effect starts to show, it's probably 5-6 months in. So changes would have occurred within those 3 months, yes, but because you blocked it, it's almost like your brain went into confusion. So it's like it doesn't know. What happens is that those medications target what you call neurotransmitters in your brain. So when they are messed up, then it could lead to relapse. So I think it would be important to see a psychiatrist again.
Okay, well noted. In case anyone has a question and they'd like to talk to Dr. Mercy directly, you could raise your hand. And since there's no one who's raised their hand, I'll just go ahead and read the next questions on Slido, where someone is asking, what's your take on self-care as a way to manage mental health? And I will join it with, what's the advice you'll give to someone who's starting their mental wellness journey?
So self-care could look like anything, even just visiting a therapist is self-care, but it's important because with self-care, because you form a routine, you're able to know when things are going out of hand. So it's easy for you to identify where you need to seek help or where you need to slow down and when things are not going okay. So yeah, I think self-care is a good way, although if it's overly done, it can also be dangerous. Now, the next question you asked is what I'd tell someone.
What advice you'd have for someone who's starting their journey to trying and get being mentally well?
Okay, so no matter what that looks like for you, consistency is key. For instance, if you're seeing a therapist, if you're going for therapy, it would be important for you to stick through to the number of sessions that you've been told. When you start feeling like, today I didn't feel as sad as I was feeling, so I don't need to go. Sometimes there are unresolved issues and you may think that you're doing okay, and then before you know it, you're back to square one. So be consistent, exercise a lot of grace to yourself. This is why I say this. Some days, especially in your first days of trying to be very cautious about how you deal with stuff and taking care of your mental health, you may feel like things are going really nicely. And then the moment you just feel like you're very stable, maybe grief hits you or something, a very traumatic event happens. And then before you know it again, you're feeling very low. And it's in those moments where it's easy to give up. But remind yourself that life in itself is like that. Even healing is not linear. Even if you were to go and see a doctor today for whatever illness it is, it may be cancer. One day, you go to a doctor, you've gone through chemo and radiotherapy, and you're feeling like, it's almost like I'm getting better. Then something just happens and there's a tumor that's recurring. It's the same thing even with your mental health. You may feel like I have everything in order, then something happens and it's almost, you're shaky, and the easiest way out is to give up on yourself. So just extend a lot of grace to yourself and remain very consistent.
Okay, thank you for that. So the next question is just about mental health care. What do you think people should do differently?
Differently about what?
Like to promote like the mental well-being. Kenyans and how they take their things, the routines we have, the common practices we have. What do you think someone can do differently just to make sure they are very well?
Okay, like you've just said, their routines. So as is right now, all of us have a certain way of doing things. And the funniest bit is that at one point, all of us know when something we are doing isn't working well, but either because of just not wanting to or fear of the unknown, you'd rather do what you're used to. You say, well, better the devil you know. You'd rather do the things that you're used to that affect you in a certain manner instead of trying other things. So the first thing I'd say is check on your routine. If at all, like, things like, they say Kenya is a drinking nation. We drink a lot as a country. And like, just from the health perspective, alcohol isn't good for your health. What alcohol and other drugs do is that, like I've mentioned, neurotransmitters. Now, neurotransmitters are things in our brains that relay information that also affect how we feel and how we behave. So all the drugs that people use mimic a certain neurotransmitter. They either mimic it and do what they do, or they block it. That's how an addiction begins. So because all these drugs have a way to our brain, which affects how now mentally we are, because there are people who end up having substance use disorders that co-occur with other mental illnesses. You may find drugs that cause you to end up with anxiety, drugs that cause you to end up with bipolar or not PTSD, depression. So just thinking about what you do, what do you give to your body? Is it helpful? How often are you on your phone? How often are you in front of a screen? Is that helpful to you? How often do you engage in positive activities? Like, do you exercise? Do you go just to breathe for nature walks? Are you constantly just locked up in a room playing FIFA or constantly watching movies? So it's basically just assessing what you're currently doing and thinking about, if everything I was doing right now was to make me be the best I would be in my mental health, then why am I not there? If it's working, continue with that. If it's not working, it's a wake-up call to change it. That's what I'd say.
Okay, so just before we wrap up the session, there's a very dominant question. I feel like you had addressed it. I just hope you don't mind having a recap, because so many people are asking about how do you deal with depression? Like, just give just an overview of how to do it.
You see, by the time it's diagnosed as depression, you probably need help. You need someone to help you navigate through it. But if it's just sadness that you're going through, or you're going through a situation that is causing you a lot of stress, then it will be important to find positive coping mechanisms for it. So whatever that looks like for you. If you enjoy music, if you enjoy movies, you can do that to help you feel a little bit more kama umechangamka, but then also do not overdo. Find other things also to do. Sometimes being in the same environment is the cause of constantly feeling under pressure. So instead of constantly being in your hostel room, why not just go maybe to Eldoret town and just take a walk, even if you need to shop. Remember, I said also don't go to malls and spend money you're not budgeted for. So just go take a walk, hang out with friends, talk about whatever it is that is causing you stress. If you can find a social support system that is helpful, if not, again, I reiterate, please seek help. Because with depression, it can get out of hand way too quickly, and then there's suicidal thoughts, and you're constantly thinking of harming yourself or harming other people. And that happens especially when you are in a cocoon where you do not want to talk about your issues. So just look for those pointers, like I said, when things are not as they were. You're sleeping too much, you're eating too much, you do not want to be around people, you're just constantly thinking of what would it be like if I died today, or will people really miss me if I'm not there? When those kind of thoughts start to show up, please seek help, run and seek
Okay, thank you very much, Dr. Mercy. I feel like the session has been very, I don't know, very informative. There are so many things I didn't know. You've made things look so simple about mental health. You've made us understand. Yeah, and we look forward to organizing many more sessions, because I believe like it all starts with your brain. If it, whether you call it brain or mind, if you're not okay up there, you're not gonna be okay. The rest of your things are just going to be in a mess. So for anyone who has a question, you can still send through Slido. We're going to make sure that they're going to be answered. We'll share the responses maybe in a video. I'll just do a reply in the Slido. And then so many people are asking Dr. Mercy, like, how do we get to contact you? How much do you charge for a session? Are you online? Does it have to be physical? Like, how do we reach you?
I'll just type my contact in the chat. So I usually charge 2,000 bob for my sessions, but for the first session, the reason why it's 2,000 bob is because it takes a bit longer because of taking history, and then 1,500 for the consecutive ones. But of course, because you're students, I know that may be a little bit too much. So we can, for students, probably we can do 1,000 for the first session and 500 for the rest. And I offer both virtual sessions and physical ones, because I understand most of you maybe are far away from Nairobi. Since I'm in Nairobi, I still offer virtual sessions.
Okay, before we wrap up, I see Ivy has her hand up. We just give her the opportunity.
I just wanted to ask on the sessions, can we like have group sessions? And if it's possible to have group sessions, how much do you charge for like group sessions? So like if we decide to have like this group together next time and have like a more deeper discussion on mental health, so how much will you charge for a group session?
You see, now with a group session, it would have to be people who have similar needs. So if not all of you have the same needs, it would maybe be difficult. If it's just to have another discussion like this one, I could do it pro bono, I could do it for free. But if you want a group session where you have similar issues, then I'd have to charge you per head. So it would depend on the number of people in that group.
Okay. Dr. Mercy, what final words do you have for us?
I think the most important thing to remember is that sometimes the situations that you're in that seem like they're endless, they do come to an end. If you find positive ways to deal with them, and just allow yourself to be human, because you know the reason why we sometimes end up feeling very frustrated is because we expect ourselves to act in ways that are beyond our own strengths. So extend a lot of grace to yourself. When you feel like things are not working out, allow yourself as many chances to start again. Constantly do it, be consistent, and with time, you realize that it's only time. The difference between where you are and where you want to go is time. So be consistent, be very patient with yourself, do the best that you can with the chance that you have.
Thank you very much, Dr. Mercy. Thank you everyone who joined in. And I don't think this is a last. We can't call it a last, because there are very many things I feel like we still need to know about mental health, and we're going to organize other sessions. And we hope that Dr. Mercy, you'll be willing to join us. We'll be very glad to have you as us. We've met someone who relates well with us. You know, you visit some therapist, you tell them about love, then they tell you, well, you are a very young person, what are you doing in love? You know, yeah, but we thank you, like how you've addressed these things. You've related with us very well, and we look forward to having you in other sessions. So I think I'll just say this is the end of the session. Thank you for everyone. If in case you need the recorded session, just approach anyone, Ivy, me, Cliff. We're going to have the session. Goodbye, everyone. Till next time.
Bye. Thank you.
Thank you too.